Good afternoon and welcome to COVID-19 media briefing. Please be advised that today's conference is being recorded. If you require any further assistance, please press star zero. I would now like to hand the conference over to your moderator today, Mr. Teddy Sean. Thank you. Please go ahead, sir.
Good afternoon and thanks for joining today. We'll have a series of speakers, including Governor Tim Walz, Department of Health Commissioner Jan Malcolm, State Emergency Management Director Joe Kelly, Deed Commissioner Steve Grove, Minnesota Management and Budget Commissioner MYRON FRANS, and Met Council Chair Charlie ZELLE. As a reminder to reporters, please limit yourselves to one question each with a single on-topic follow-up. And with that, I will hand it over to Governor Tim Walz.
Thank you, Teddy. Good afternoon, everyone, and good afternoon, Minnesotans. Thank you again for joining us. I hope everyone had an opportunity over the Easter weekend and Passover to have time with immediate family, to be reflective on the important things and the family that's around us, and just incredibly grateful for how everyone is handling this and keeping themselves and their neighbors safe. A week ago on Sunday, I gave the very unusual State of the State address from the basement of my residence here, and I used the weather as an illustration, talking about winter, and I think the last few days have also been fairly illustrative of the fight we're in, where it was bright and sunny and warm on Saturday and snowy on Sunday and a little cold and windy and sunny this morning and now snowing again. And I think probably the rhythm that we're in and the way that we'll attack COVID-19 is going to be a little bit of that. So while I think there's every reason for us to be optimistic that we have a plan to contain, mitigate, and then be as aggressive as possible tackling this thing and then coming back into our economy, I caution everyone, if you're watching national news and seeing what appears to be a plateauing and good news out of New York State and others, to be cautious that we're just not to the point. It's not just here yet in full force. And our hope is, and our planning and our science behind it, is that we can stop it from being quite as destructive, because we will have the opportunity to take and make changes, especially around the ability to make sure our healthcare facilities and our providers are prepared to deal with it, that we have the proper equipment, from PPE to ventilators to the ICU rooms, and then make strategic plans on what we've learned about COVID-19. And it was just a month ago, 30 days, that we declared the state of emergency. I'm asking to re-up that for 30 days, and asking and interpreting state statute that the legislature certainly needs to make sure that they are comfortable with that and that we are moving together. And we will do that tomorrow to move that forward. But there's some things on here and some things that are being done, and you're going to hear from a few other folks today. One being Met Council Chair Charlie ZELLE is going to talk about what is creative thinking about helping our neighbors. Met Council and our ability, especially around transit and moving people around, critically important to our 7-county metro area. But Metro Mobility is providing free door-to-door service from home to work and from work to home for any person who works in healthcare. I'm proud they're taking this action. They've been out there for weeks now delivering meals to our seniors via the drivers at Metro Mobility. So a big thank you to that team over there. They're also the ones that, when I needed them to, met the plane on the tarmac from the cruise ship to get people back to their homes all across Minnesota. So really grateful there. And, of course, you're going to hear from Commissioner MYRON FRANS that we're obviously watching state budgets very, very closely, looking at how we're using resources to effectively fight this fight against COVID-19. He's going to highlight some of the things that we're doing that we believe make sense, and also some of the things that we know where everybody's tightening their belts, and we've initiated things from hiring freezes to other budgetary management practices that will keep us in a good spot. I've also asked the commissioner to do an extraordinary budget projection. We usually don't do those until November. We're going to ask to get one here in May that will start to assess where we're at, and then, of course, how do we plan afterwards. So Commissioner Franz will take some of those. Again, as I said, we've extended the peacetime emergency order through May 13th. We believe that we're working in the right directions to save lives. The declaration ensures the state can respond as quickly as possible, so I'm grateful. One thing I'd like to note is that while we're seeing social distancing, and I'll keep continuing to ask folks to not get complacent about that. One of the things is that we've significantly reduced traffic on our roads, but road fatalities are rising, and we know that that we've got folks speeding at this time because there's less cars on the road, and I'm not quite certain why that is. But to date, we've had 76 fatalities compared to 71. So please, watch yourself when you're driving. Please, our state troopers and other first responders and law enforcement don't want to be stopping people all the time. So it's best if I would just ask if we go along and pay close attention to that. And I would also mention we have several other things happening at the same time. Flooding along the Red River Valley up in northwest Minnesota, and flood stage in Osseo is 37.5. And today we're at 37.76, but the good news is that's coming down from 37.91 over the weekend. Our National Guard has been deployed up there for about the last 10 days, and I want to say thank you to them. It looks like maybe by Friday we'll have this thing under control and bring them back off that duty. But I have great respect. I had the privilege of being deployed in 1997 to the Red River floods as part of my National Guard unit, and I know what it means to those communities, and I know what these families are going through giving that service, so thank you for that. And once again, before I turn it over to Jan Malcolm, I just want to remind Minnesotans the purpose of this. The purpose is to save lives. It's to reduce the impact on the most vulnerable. And when I asked for that original emergency action, I asked for it and then the stay-at-home order that we just extended to buy that time. And we thought about it immediately, and I said the way we come out of this, and this is the way we have to do it nationally, is we have to test and we have to trace, do contact tracing, and we have to isolate the people who need to be isolated. And this has to be on a massive scale. And as I've been talking about now, Minnesota is shifting into that point where you're going to see exponential growth in our testing. We are trying strategies that are not being tried in other places. I am working with other governors. I spoke this morning with Governor Evers and Governor Whitmer, and spoke with Governor Burgum on Friday about thinking regionally, how do we restart our economies together. But the only way that this can happen is that we have widespread testing, permeating testing, both on initial testing and serology testing, that we do contract tracing to continuously isolate folks as immediately as when we find or previous or before hotspots develop, and then isolate folks smartly and keep the capacity in our hospitals there. So our intentions have always been to get to a point where we can push a full court press on it. We're not seeing it nationally. We are not testing nearly widely enough. The PPE situation, just to give you an idea, the average burn rate for PPE before COVID on N95 masks was about 3 to 5 million per month. We need 120 million per month. So when you hear numbers about 5 or even 10 million masks being delivered, it is way, way too small. So here in Minnesota, we're going to think about how do we have to make the swabs ourselves? How is it, what's holding us back on the reagents? What's holding us back on the testing? Because those who want to open this economy, and all of us do, have to know the only way we do it, it has to be in conjunction with the best health advice, the best epidemiological evidence, and that right now is testing, tracing, and isolating. So with that, I'm going to turn to Commissioner Malcolm to update where we're at today.
Thank you, Governor. I will start with the usual data update globally and nationally. The global total as of this morning was more than 1.86 million cases and almost 115,000 deaths around the globe. In the United States, we are just under 560,000 confirmed cases, just over 190,000 in the state of New York, over 103,000 in New York City alone. The United States is now reporting just over 22,000 deaths, almost 7,000 of those in New York City alone. Here in Minnesota, we are today reporting a total of 1,650 cases, which was up 29 more cases from the most recent report total yesterday. I would like to clarify, however, that the numbers the last couple of days due to the holiday weekend are not an apples-to-apples comparison with prior days. On Sunday, we posted on our MDH COVID webpage test results running from Friday evening through 8 p.m. on Saturday, which is not our normal timeline for pulling the data, given that we typically cut off those test results at 4 o'clock the preceding day for the following day's update to the media. So that we had a longer time pull on Saturday, which resulted in a larger number of cases. And then today the numbers reflect only the additional cases that were confirmed between 8 o'clock Saturday and 4 o'clock Sunday. So to try to make that a little more plain, on Friday we were reporting 1,427 cases. Saturday, the comparable number would have been 1,536, so an increase of 109 on Saturday. Sunday, and then the update from today would be a total of 1,650 on Sunday, or an additional 114 cases. There have been no new deaths since yesterday's report, so our current death total remains at 70 for the state. So what you see in these numbers, again, is consistent growth, but kind of on the same pace that we've seen, slightly larger numbers each day as the total cases grow, as we expect them to do. As of today, 842 patients have been released from isolation. There are today 157 patients in the hospital, 74 of those in intensive care. I do have Director KRISTEN on the phone as a resource if you have questions later in the hour. We also appreciate having this opportunity every day to reinforce some key message that's important from what we're seeing on the ground. And today I'd like to talk about personal care assistants for just a moment. We've been getting some questions about the role of personal care assistants, or PCAs, and whether healthcare providers should be allowing them to attend healthcare appointments with their clients. Given the important role that PCAs play in supporting patients, we encourage healthcare organizations to allow home care staff and family caregivers to attend appointments with people who have disabilities or chronic conditions. While MDH and CDC guidance is to limit visitors in these settings, nothing says that an individual with a disability or chronic condition cannot bring a caregiver with them to appointments. Home care staff, such as PCAs and nurses, as well as family caregivers for those who do not receive home health care services, are not just visitors. They're not visitors at all. They work for patients who require personal care and medical care assistance due to their disability and chronic condition. Home care workers have been designated as Tier 1 essential employees by the governor's order and are authorized to go to work. In home care, going to work means going anywhere your client needs to go and are required by law to be physically present with their client at all times in order to be paid. Oftentimes, this means going to medical appointments with their client. So we just wanted to clarify that for our healthcare provider partners, and we thank PCAs around the state for their excellent and vital work. We encourage all providers to ensure that they can do this work for their clients in their facilities. And with that, I will pass it off to Director Kelly at the SEOC.
Thank you, Commissioner, and hello again, Minnesota. I'm happy to report that over the weekend, FEMA approved our request for what we talked about last week, that non-congregate sheltering. And that means we'll have the opportunity to seek reimbursement for providing people affected by COVID-19 with a separate place to live while they go through quarantine and isolation. And this will help reduce further community spread of the virus. This will allow us to provide shelter when someone tests positive or has been exposed to COVID-19 and simply can't go home. As we talked last week, this includes people experiencing homelessness and those who can't return to their usual residence because of the risk of exposing other household members. So we're grateful for FEMA's support and look forward to even more good news soon on our request for crisis counseling program grants. Very quickly, changing gears and kind of echoes what the governor said earlier, this is Severe Weather Awareness Week, and we were reminded that bad weather is always a threat after communities in Louisiana, Mississippi, and Georgia were hit hard by tornadoes last night that caused significant property damage and a number of fatalities across the southeast part of the country. We live in Minnesota and need to be ready for anything, weather-wise, at any moment. So throughout the week, I'll mention the preparedness theme of the day. Today's focus is on alerts and warnings, including encouragement to get an app that will send a warning to your smartphone if dangerous weather is imminent. It's kind of like having a siren in your pocket. So please visit our website for more information. And with that, I'll turn it over to Commissioner Steve Grove of the Department of Employment and Economic Development. Commissioner Grove.
Thanks, Director Kelly. Good afternoon, everyone. This is Steve Grove from DEED, and I want to share a few updates from the economic analysis we've been doing over time on the impacts of COVID-19. We saw so far 428,203 cumulative unemployment insurance applications from March 16th until yesterday. And, week over week, we've seen those numbers go down a little bit, starting with a peak of 115,000 applications in that first week of March 15th through the 21st. The following 2 weeks, we saw around 109,000 applications, and last week we came in at around 89,000. So we were down about 18% last week over the previous week, and saw an additional 3,943 come in yesterday. So we continue to track those numbers to see how people are taking advantage of that program and making sure we can respond to those applications as soon as possible. The number of applications continue to pour in the sectors that you'd expect. The top 5 sectors remain food preparation and serving, sales and service, healthcare, including both practitioners and support, office and admin support, and production. So we continue to make sure that program is stable, that we get benefits out to people as quickly as possible. Last week, as we mentioned, we were the first state in the country to issue the $600 top-off payments from the Federal CARES Act, and this week we're really honed in on the other 2 elements of that program, the 13-week extension and the ability to provide unemployment insurance to the self-employed or independent contractors, both of which are major lifts and major new extensions and programs for unemployment insurance that the team is hard at work at. We're continuing to work on helping small businesses across the state. Our Small Business Emergency Loan Program, that is, again, a state taxpayer-driven program, has authorized 162 loans, $5.25 million through 11 nonprofits. Those loans are coming from across the state, and once they reach D, we get them turned around within 36 hours. We've built a process that is really built around speed once those applications reach our office so we can get money out to people as quick as possible. And with that, I'm going to turn over to my colleague, Commissioner MYRON FRANS from the Office of Management and Budget. Commissioner FRANS.
Thank you very much, Commissioner Grove. This is MYRON FRANS, Commissioner of Minnesota Management and Budget. We know that the coronavirus is impacting our state's economy, businesses small and large, and also the lives of our family, friends, and neighbors. But we need to put every resource into combating this virus and ensuring that those fighting on the front lines have what they need to do so. But we also need to know the financial impact this is having on our state budget so we can plan appropriately and make modifications where necessary. In anticipation of expected budget challenges due to COVID-19, Minnesota Management and Budget is working with Governor Walz and Lieutenant Governor Flanagan to prepare a budget projection plan which does 3 things. First, Governor Walz has directed MMB to release an updated budget projection in early May based on the latest economic and budget indicators so we have a better understanding of the COVID-19 impact on our state's finances and we can adjust accordingly. Additionally, at that time, we will have or should have received some of the federal funding from the most recent congressional action. Second, effective immediately, we will institute a hiring freeze on all executive branch positions. During the freeze, agencies may not fill any vacant positions and no new positions may be created except for those related to our COVID-19 response. Agencies are also not permitted to use professional technical service contracts or other contracts to circumvent the hiring freeze. The hiring freeze does not prohibit reassignment or redeployment of existing employees, nor does it prohibit hiring for vacancies which must be filled by law. A previous executive order last month has already resulted in a reduction of 1/3 of open positions across the enterprise in our initial partial hiring freeze. And last of all, Governor Walz and his Chief of Staff and all 24 Cabinet Commissioners will take a 10% pay cut for the remainder of this year. I will now turn it over to Chair Charlie ZELLE from the Met Council.
Thank you, Commissioner. Hello, everyone. This is Charlie ZELLE, Chair of the Metropolitan Council, which operates Met Transit. As we all know, Met Transit has been providing essential transportation throughout the metropolitan area, but at a much reduced service level. We know that health workers are dependent, many of them, on transit to reach their job, and given the reductions, it hasn't had the access that they previously have had. So, as the governor mentioned, starting today, Metropolitan Mobility is providing free door-to-door service from home to work and work to home for any person who works at a healthcare facility 24 hours a day, 7 days a week. And, we're able to provide this service because there's an excess capacity afforded by the drop in demand for Metro Mobility services. And has been announced before, and because of that excess capacity, we've been delivering groceries directly to the homes of Metro Mobility customers, and actually food from food shelves for anybody identified by the food shelves in need. This new service that we're starting today is going to provide kind of solo or small group, but direct on-demand express routes for these essential healthcare workers. So it really is going to be fairly simple. Healthcare workers need to call our Metro Mobility receptionists or go online. It's at a website under the Metro Console for Metro Mobility Transport for Health Workers. They need to simply provide their employee identification badge, that they're employed by a healthcare facility. This is not just nurses, doctors, but any kind of support personnel for healthcare. So that is part of our innovative idea to continue to get people safely to where they need to go. And right now, healthcare heroes really need a primary protection. Thank you, and with that, I'll turn it back to the governor.
Well, thank you, Chairman Zelle. I want to say thank you, and thank you to your drivers who have been out there on the front line, and we're continuing to hear them about getting them the personal protective equipment. But that selfless, compassionate service that they're delivering is really appreciated. With that, operator, we'll open it up for questions.
As a reminder, to ask a question, you will need to press star, then the number 1 on your telephone. To withdraw your question, press the pound key. Your first question comes from the line of Esme Murphy from WCCO-TV. Your line is now open.
Governor, Commissioners, thank you so much for taking this question. There was a news conference this morning at the Capitol with restaurant owners expressing concern that when May 4th comes, they will not be able to reopen. I don't know if there's a comment on that, but also they are seeking to be able to sell bottled wine and beer, which they said could provide an additional revenue stream to keep them afloat. They want the governor to sign a special order on that. Governor?
Yeah, thank you, Esme. First of all, I am totally supportive of that, and we've been exploring it. I think the reason on this, and we're still looking at it, looking what other states did, I support them being able to sell the alcohol. The easiest way to fix this, and what I've been asking for, if the legislature just moves it tomorrow, and then I'll sign it into law tomorrow, because we think there could be some challenges on the executive order of this, not tied directly to the health pandemic, but I hear them on that clearly. We're trying to do everything we can, as I said, to keep these businesses afloat, making sure that they're doing a great job on curbside pickup or the delivery. And then, of course, I will keep stressing this, looking at the smart, safe way to reopen the economy. And I think many of the folks across the country, including governors in neighboring states, believe the way to do this is to significantly ramp up our own testing capacity, our contact tracing, and then our isolation. But my message to those owners is I fully support that. I'd sign it into law tomorrow. We are still exploring if the need for an executive order, but the easiest way is just to pass it tomorrow and then give it to me because they're back in session.
And these restaurant owners were asking about that May 4th deadline, as are Republican leaders who are wondering if you can lay out a timetable for reopening the state.
Well, the virus will lay out the timetable for us, and our response to the virus will help us be able to address to that. What we've said all along is, and I will keep coming back to it, is we have to have an accurate way to understand who is infected currently and who has been infected. We have to have a way that we can test everyone who needs them and everyone on the spot, both for the disease and for the serology test that shows the antibody. And then we have to have the capacity to be able to isolate them, which we do believe we have. Now, the things that are going to be dependent on here is to do that testing. You need the test kits, you need the reagents, you need the swabs, and you need the PPE, all of which are in short supply across the country. It's one of the reasons why I'm asking my team, and we're trying to figure it out with the University of Minnesota, with Mayo, and with some of the other providers, is to create our own capacity to do that here. So I can't say the date on this because we're still looking at where things are moving. We're still looking at what are the best ways. We know that social distancing is certainly our best protection against this. And what I said in my last executive order on extending the stay at home, that we in Minnesota are going to be smart and modify where we can, where the science is behind us and the capacity to do what we need to do, we will make changes to that. I think most of us understand restaurants and bars are some of the most crowded. They're very difficult to do social distancing in. So we're going to have those pieces in place for the testing, tracing, and isolation. And I think there's no reason to think that anyone else is going to do it any sooner. I don't think you can just set a date, because if you remember a few weeks ago we were having this debate. We were told that we were going to have full churches. We were going to have everybody back to work. Well, no one, you can't force where the virus is at, and you can't force what we're learning every day. So my message to them is that I hear you loud and clear. I want to make those changes on alcohol if that helps for the short run, and I am going to continue to push to do the things that will be the smartest ways and the quickest way for them to reopen. It's by testing, tracing, and isolating.
Thank you, sir.
Next question is from Tim Nelson from Minnesota Public Radio. Your line is now open.
Yeah, Governor, I want to follow up a little bit on that. Legislative Republicans now are questioning your extension of a peacetime emergency and asking for more negotiations about stay-at-home modifications. Do you think that reflects wider doubt in Minnesota? And if so, do you think people are still going to adhere to the state orders, and how are you going to convince them to do it?
Well, I think the one thing is Minnesota is a state that follows science. They understand this. I think they see that the rest of the country, the places where they're getting a handle on this, are following these procedures. It's certainly a constitutional authority that was given by the legislature and the voters of Minnesota to the executive branch. I think we're exercising those in a judicious way. We're asking for their input. Yes, we all want to open up tomorrow, but people will die if we do that without having things in place. So there's not a debate here about whether we need to get the economy open again. Of course we do. The debate and the strategy is, how do you do that in a way that ensures, as this virus continues on for the next 12 months or whatever it takes to get a vaccine, that we are in a place where we can weather these squalls that come in with it and then blow back out again. So I think Minnesotans understand this. I think they understand this isn't about just you alone. It's about the idea that you may be healthy and you may have already had it, or you may be carrying it asymptomatically, but people who don't. And that part of it is I think Minnesotans have adhered. We're seeing it, that we have some of the flattest curve, or the flattest in the country. We've seen testing rates that are continuing to go up. When you see places that don't do this and you allow people to go back to work, your economy shuts down anyway, like the Smithfield plant in Sioux Falls. So my first responsibility is to people of Minnesota. It's to follow the best practices on this. It's to build coalitions around us in the states around us, which I think is the model the rest of the country will start to pick up, and then to ramp up this testing. So I'm confident Minnesotans get it. I'm confident that Minnesotans understand that this is about protecting their neighbors and figuring out the quickest way to get back into the economy.
And a quick follow-up for Commissioner Malcolm. You said there are no new deaths. Are there really no new ICU patients and no new hospitalizations to report today?
Thanks. That was part of the confusion with the numbers changing over the weekend, just because of the data pool. So I think what was stable since last night was the number of deaths. I'll ask Chris, who I believe is on the phone, if she can clarify further.
Yes. So, Tim, the issue is that the data is coming in continuously, and so we have a cut point that we use so that the data you get at the 11 a.m. report is based on that cut point. And there was a mistake in how the data were presented for Sunday, and because of the holiday and a number of things, we don't have the new data for you, but we will tomorrow. So that is the issue. So you'll get the complete data set tomorrow, but at this point, no, we don't have any new information on deaths or hospitalizations from what you got.
Thank you.
Next question is from Matt Sipik from Minnesota Public Radio.
Hi there. This is for Commissioner Malcolm or KRISTEN. Who determines the priority as for antibody testing as that begins to come online, given the given the likelihood, I should say, of limited supplies, and who will be in the priority groups for the new tests?
I'll start and then turn to Chris for further comment. I think we look at all of those issues in close collaboration with our clinicians and clinical partners nationally and in the state. Certainly the Centers for Disease Control and Prevention continues to issue guidance on prioritization criteria of various kinds for equipment, for testing, and making sure that we can serve the most vulnerable and the people for whom tests, for instance, make the most difference in their clinical course of care. Here in Minnesota, we also have good consultative processes. The infectious disease physicians, critical care physicians, and ethicists actually are talking together and with us all the time to try to inform our approaches to those things so that they're clear, they're transparent, they're fair, and to the degree possible consistent across the state.
And I'll just add to that the Department of Health has put out guidance for health systems to consider when looking at limited testing availability. The Department of Health, I think as we've talked about in the past, we feel that we have an obligation to make sure that we're able to provide the testing that's needed for the most vulnerable populations. So for the Department of Health, we're asking that specimens from ill individuals, residents, or staff in congregate living settings, so that would be long-term care facilities, prisons, jails, homeless shelters, that they would be prioritized for testing, as well as dialysis patients. That's for the Department of Health. But then for the rest of the health system, we include those groups, but then hospitalized patients. So as the Commissioner said, individuals for whom the test result will make a difference in their care. A positive test result means that these individuals could have access to drug trials and things like that. We've got healthcare workers. We've got first responders. We've got child care providers. So we've got this whole list of individuals that we have at this point prioritized for testing, given the limited testing supplies that are out there. We do know, we have been hearing that many systems are not testing healthcare providers outside their own system, and we beg them to reconsider because we need to get individuals who are working in congregate care settings tested. This is a very likely way that disease is being introduced into these settings, and these people need to know their status. So we would implore that these individuals can be tested. But having said that, we've put out guidance, and obviously health systems work within that guidance, and if they have greater capacity, they can expand testing. So this is not to limit testing. This is to say, if you are limited in your testing, here are groups that we think you should be considering for prioritization given their vulnerable status.
Okay, thanks. And just a quick follow-up to that. When do you have a time frame at which point testing will be available for anybody who wants or needs a test, and you don't have to have limits or priority lists for people getting a serology test?
Matt, I'm gonna take that one, Commissioners and Chris, because I'm setting the challenge here to all of us. Just to give you an idea, Minnesota's tested about 40,000 since the beginning of this, 40,000 people. Iowa, about 17,000. That's fairly typical if you look around. We need to be testing 40,000 a week or more. We need to be making sure that the testing and the PPE are there. So those people who are saying open the economy, you're right. And to do so, we need to be testing 5,000 people a day, and that needs to happen as soon as possible. So, Matt, I'm asking our team to figure this out. This is a broken system across the country. We've tested less than 1% of the American population. Epidemiologists and others will tell you what that number needs to be, and it's an awful lot more than 0.9%. And so here in Minnesota, I can no longer wait. When the federal government tells us, hey, we sent you these 15 quick tests, these kits, they're awesome, 120 tests, and then no reagents, and then if you try and reorder it, you're forbidden from reordering because FEMA has the order. That is happening, and I tell that to you. That's not even out of frustration or what's happening. It's simply a reality. We need to get there within the next few weeks up to a capacity where you're exactly right, where everybody who wants a test, but then we can test the people we want to have them. So I'm speaking here as the governor who needs to make sure that this happens. Our folks know, and this is going to be a hard lift because of the shortage of all the things that are out there, but just those that keep asking, what's the plan to reopen? The plan to reopen is very, very clear. Test, trace, isolate, open back up, and continue this until we get a vaccine.
Okay, thanks, everybody.
Next question is from Kent Erdo of KRTV. Your line is now open.
Yeah, thanks, Governor. I wanted to get your response to the president's well-publicized tweets this weekend suggesting that he's got power to supersede the states when it comes to reopening things. Can you respond first?
Well, thanks, Ken, for the question. First of all, my responsibility is to the people of Minnesota to stay in my lane, to continue to do exactly what I'm doing. I think the Constitution's pretty clear on health and safety issues to the state. But what I've avoided through this whole thing, and I'll continue to avoid, is I just want to work with anybody who wants to get this thing over. I would ask that, again, if there is that plan and the president is deciding when things are going to be open, they need to be deciding based on, have we contained and mitigated the virus? Do we have the testing regimen in place to be able to continue on into the future doing that? And do we have the resources necessary to do the contact tracing and isolation? So I would just say certainly Minnesota is welcome, but being on the ground, seeing what needs to be done, I'm going to continue in my lane with the expectation that we open when it's safe to open. It makes sense. We've taken unique and I think strategic approaches to this, where even in last week's order, we from garden centers to other things that were able to come back online, we're continuing to do that. We're working with our businesses who are saying, hey, we've got a mitigation plan. We've got the capacity to do this. Look how we're disinfecting between shifts and at workstations. Those are smart things, and we can get them up and running. So I just hope the president's willing to work with us and not make an arbitrary decision that I think goes against all the best advice of both the health and the businesses on the ground here.
So going off of that, we saw last Friday the different scenarios that you were presented with, according to the models at least, when it came to getting things reopened for Minnesota, one of them being extending the order, the other being more narrow with the order for the long-term care setting. Clearly you made the decision that you made, but as you're looking at moving forward, would you consider doing more of a targeted stay at home, and would the testing and tracing have to be in place by then?
Yes, and thank you for going over that data. Scenario 3 is the one that I think we need to get to. I think that's the most sustainable one. I think that's the one where the most vulnerable are kept isolated, where we're continuing to put out hotspots, and we're working towards that time when we get a vaccine. The problem is we are not ready to do scenario 3 yet because we don't have the testing in place nor the PPE. So the time that we're buying now and the time that we're using at the stay-at-home order is to not only just have the hospital capacity ramped up, which that's a separate lane that's being worked on and getting done. It's to do this second part of it is the testing and the PPE. So you're absolutely right. Scenario 3 is with the continuing to ask people to be diligent about social distancing, to have it narrower in focus of a stay-at-home order, but being able then to know that at any large manufacturing facility, whether it be a meat packing plant or whatever, I could test every single person in there for antibody. I could test every single person's, take them in when their temperature comes in. We could get someone, we could trace their contacts back, and we could isolate that family away from the other workers. That's the scenario of getting going, and that's the one I want to get to. But what has plagued us through this whole thing from the beginning is the lack of testing and the lack of personal protective gear, which puts people not just at risk, it makes the spread go much faster.
Having said that, is that realistic by May 4th to have that kind of capacity?
We're going to find out. That I think I have not guaranteed that it'll be by May 4th, but I think it's reasonable for us to continue to look at this in smaller chunks. I didn't think it was prudent to extend a stay-at-home order for a full month. If we think we can have the capacity, the sense of urgency that we have, some of it is constrained by supply chain constraints, but I'm asking our people to think differently. We're blessed here in Minnesota that we have not only a vibrant public health sector, we have a private sector, and from Mayo Clinic, University of Minnesota, to all the other health systems that we have are working closely together. So we think it's a moonshot type of go, but certainly it's not going to come from a federal strategy that is not seeing this, even though you hear from all the health experts, this is something that has been clear from the beginning to me, and I don't think it's changed as we gain more information about the virus. Testing, contact tracing, isolation. That's the real key. And then I think what a lot of people are saying is, hey, I've either had it or I'm young and healthy, I'm social distancing, let me go back to work. If we have those things in place, that's exactly what we can do. And then we can keep the most vulnerable isolated, and we can put out the hotspots. So I don't know whether it's realistic, but it certainly needs to be a goal that we need to shoot for. I'm, again, setting the bar incredibly high on this because, again, as I've said from the beginning, we cannot shelter in place or stay at home for the entire time it's going to take to get a vaccine. That's not sustainable. We knew that. So we asked for some short-term sacrifice out of folks. Give us the time to build this up. That's what we're trying to use it for. I would wish that we would use the Defense Production Act, and I wish they would be manufacturing 250 million masks a week. And I wish we were doing test kits massively. But what we're going to find out is what can we do for Minnesota and the surrounding states together? Can we use the capacity that's in Michigan, Wisconsin, Illinois, North Dakota, Minnesota to build a block of things necessary to do it? So we're going to attempt to ramp up our testing fairly significantly in the very short term.
Thank you, Governor.
Next question is from Theo Keith of Box 9. Your line is now open.
Hi, Governor. You very clearly today tied reopening the economy to having enough tests. You're saying that we need to test 40,000 people a week. We haven't tested 40,000 people yet in all of this. So I'm asking you, at our current pace, how long is it going to take, or at a realistic pace, how long is it going to take before we have enough testing so therefore the economy can reopen?
Thank you, Theo. At our current pace, way too long and unsustainable. I certainly do not debate anyone who says that a shelter in home, are in place for 6 months. There is no way that will work. The damage to the economy, the damage to everything else. So we took the approach was, and this is what we're still hearing federally. We're just not seeing a ton of the results yet on it, but we hope that it's starting to get there. Is that they're going to start pumping up the PPE. They're going to start using the Defense Production Act. Both, and this is really important. The ventilator piece is important for the short-term triage, but the long-term sustainability and opening of the economy is dependent on the testing and the PPE. So just like Kent's question, this is a really hard lift. No one's yet been able to figure out how to do it on a large scale. I'm asking my team to figure out, both for Minnesota and the upper Midwest, is there a way that we can do that and start looking at testing in the 4,000 to 5,000 tests a day, mainly because that what it gives us is not just finding out who's infected. Commissioner Malcolm has already made that clear. It's probably for every one positive, there's 100 more out there. It's the ability then to be able to put out hotspots and return people back to work who we know have it. So I can tell you we're working with a lot of partners on this. I think you can expect or should expect us to try and make a big push at this, is what we've been doing. Again, we're into the 15th day of the stay-at-home order, basically, I guess, and we're making progress in that direction. But until you get that, it's going to be very difficult to open up again, because you'll just keep getting hotspots. You'll get the situation like Smithfield. Open up, get everybody sick. Now the whole plant shut down, and because 60 people were sick, they didn't control it. You got 3,700 people and 5% of pork production in the country out of commission. That is not opening the economy. Opening the economy means sustainable.
So should people expect all or most of these closures will stay in place beyond May 4th?
I think it's too early to say that. I think we've already made some changes in the last one. We are actively engaging businesses to find ways that they can creatively figure out social distancing, change their shift changes, look how they're disinfecting differently, and if the health people believe that it's a potential to be able to do that. I'm looking and leaning in as hard as I can. I will not open one day earlier and put people to risk, and I will not open one day late when we believe the risk has been mitigated to a point that it makes sense. So I would say it's still too early, and this is very fast moving. If we can, and I mean, we're seeing progress every day, and I don't want to sell that this is the quick fix, because we still don't know enough about the serology tests. We don't know some of the accuracies in it, but there's great potential there. And I think because of that very fierce urgency of getting the economy open again, it's worth us leaning into that and find out if we can do it. So I think it's too early to tell those folks that, and I think what you'll see even during this time as we're doing this, you will start to see a rolling back into the economy where it makes sense.
Thank you.
Next question is from Carla Helt of CARE 11. Your line is now open.
Thank you so much. I appreciate it. And Governor, thank you for your answers regarding the ongoing discussion regarding the president's claim that he alone can open up the country. And hearing you speak right now, you are putting a premium on testing, tracing, isolating. However, this is happening, of course, at the same time that they have cut off the federal funding for the testing. And as you quote, are staying in your lane. Is there a scenario, and this is just the bottom line question I have for you, is there a scenario where the president could say, I am opening up the country, but then we see Minnesota possibly staying in this stay-at-home order mode?
Well, Carl, yeah, thank you for your question. I think, I think it's, I think on these types of questions, it probably doesn't hurt to think ahead. I never like to anticipate too much like that, but only thing I can tell you is if a situation like that arises, I can only make the judgment as governor that I believe is in the best interest, the health and safety of Minnesotans, and stick with that. I certainly, as I think you've seen, have not had open clashes with the administration. We've worked together. We have been grateful for the work that we're doing together. But I will certainly, again, I can't, with the authority that I've been given, if it goes against the best advice of all the health experts to open up Minnesota, I think I would have to continue on doing what we think is best. My hope is that those two things coincide, that we're able to start opening up the economy while still maintaining our safety. So if we ever get to that, I can assure the people of Minnesota I will make the best judgment that I have on the best evidence that keeps people safe.
Thank you. And to that point as well, should that happen, at the point when you do open up the economy, can we expect that schools will also resume at that time too? Of course, New York is having that conversation related to whether they would open businesses prior to schools opening and the possible conflict and challenges that poses for families. Have you considered whether the schools and the businesses will definitely go hand in hand?
They won't necessarily go hand in hand, but they certainly could. And I think that the same scenario with schools, and you're right about there's a few more complexities and younger people not at this point in time appearing as vulnerable, but that's still going to depend on testing too. And if the testing is widespread enough, I think there certainly could be a scenario where they would go hand in hand, but they don't necessarily have to.
Okay. Thank you, Governor.
Next question is from Dave Arick of Pioneer Press. Your line is now open.
Okay, thank you, Governor. So you're basically saying if we don't get enough testing capacity, we're not opening up. And then in the same breath, you're saying you want to work with businesses who have plans to open up. And so I'm a little unclear on how this works and what a business owner is supposed to do if they want to get their business open before we have all these tests.
Yeah, there was certainly the business that was considered essential. There were businesses that, by the nature of what they do and the social distancing and their ability to be able to decontaminate, like landscaping, that were able to be added. We certainly are trying our very best in a situation with shorted testing to try and make it as possible as we can for as many businesses to operate without putting us at risk. So these businesses, and maybe Commissioner Grove can chime in here, we're setting up, and there is no protocol out there that anyone had done it. We're kind of creating it together and working with the health department to say what would that look like? What could a business do, and how do they appeal on the executive order? So, Commissioner Grove, I don't know if there's anything to add there at this point.
Sure. Yeah, thanks, Governor. Well, I think as the Governor stated in his Executive Order 2033 last week, he's asked DEED, DOLI, Department of Health to begin to collaborate for what kind of social distancing guidelines would need to be in place when it's safe to go back to work. So we are in active planning mode there. Of course, the timing is the big question, but we're talking to lots of experts on social distancing, talking to the business community, getting ideas for how social distancing can work in a variety of settings, whether they be retail or manufacturing or industrial or office. And we're collecting a lot of information, putting some options into play, and learning a lot from the business community and from workers about how we could do this safely when it's appropriate to do so.
Okay, thank you. So is there some kind of is there going to be a transparency to this, a blue ribbon commission or something, so that we have a sense of what ideas are being kicked around and who's at the table?
Sure. Well, we have a morning business call that we do with chambers across the state. We have an online form that's on our site where people can submit their ideas directly there. And we're talking to many of the business leaders in the state about the best ways that we can get that advice. And so we're learning a lot, and we're talking, of course, first and foremost to health officials to figure out what makes the most sense from a health perspective, because that's our top priority.
Okay, and then last, when is that going to be completed by? When are we going to see the fruits of this?
Well, I think as the Governor has said, we are only going to engage in any additional opening up of the economy once it is safe to do so from a health perspective. So we've always got to be planning for when that is and be ready with the right protocol and policies and procedures to get that right. But the timing, of course, is going to be determined by the very things the Governor has been talking about on this call.
No, I'm sorry. That's the timing of when the tests will be ready. I'm saying, when is the timing of when your guidelines for how businesses can open up will be ready, so at least they can plan in anticipation of the testing capacity being there?
How a business would re-enter the economy with the right social distancing guideline is part and parcel with when that would take place, when we would release guidance on businesses reopening. So I think they would be timed in the same step.
Okay, thanks.
Next
Operator,
question.
we have time for one more question today.
All right, sure. Next question is from Tom Hauser of KSTP-TV. Your line is now open.
Hello, Governor. The snow only barely slowed down my email about golfing, but a lot of golfers are looking ahead to next weekend when it's going to be in the 60s. I'm wondering if you're any closer to a decision on allowing golf in Minnesota, and will there be any restrictions on people fishing during the fishing opener? A lot of people kind of equate those two Minnesota pastimes.
Yeah, no, I hear you, Tom, and I think our teams are working on that. I for one, think if we can make it so there is no health reason or the risk can be mitigated as well as we can, we should allow people to do as much as we can. The thing is, and the question that got asked early on, are people going to continue to adhere by that? I think so, and I think the more we're able to open some of these things, I think it gives people a little bit of that, lets off a little bit of steam. So I can tell you DNR is looking at some of that. We talked about dock workers. We talked about making sure we could open up people who had boat storage to get their boats out. And then, I'm talking especially with our tribal nations who are pretty nervous, and the folks up north don't want us to flock up there now. And the irony is that they normally do because it's a big part of their economy. But I can assure you that they are working that now. That we're trying to get, and I'm asking my team to get answers on these as soon as possible. And again, they're not frivolous things that come up when people talk about the ability to sell alcohol out of restaurants. That's part of what people do. It allows them to stay open. Same thing with golf and fishing. So we hope to have an answer as soon as possible. We know that you're right. The snow probably slowed very few folks down. It's something people look forward to. And to be honest with you, in a month that hasn't had a whole lot of things to look forward to, I'm certainly trying to do the best I can to give people those type of opportunities. So I hope to get you an answer, Tom, in the very, very near future. My team's listening now. They know that this is an issue along so many others that we keep asking. So we'll try and get you those as quick as possible.
Governor, just a quick follow-up. While you've been on the call, Carl Anthony Towns' mother died of COVID-19. Any words for his family and how that's kind of a reminder to all of us?
I'm sorry to hear that. I've had the privilege and the pleasure of meeting Carl before. You find very few people with just such a positive outlook. So I'm deeply sorry for the loss in their family. And as I said, unfortunately, this is starting to hit more and more. I get cards and letters from folks every day, and they talk about their experience with it. So please accept my sympathies on this. And I think Minnesotans, when it's someone who's a little more well known, they hear about it. But this has happened to 70 of our grandparents, our brothers, our sisters, our parents. And it's one of the reasons we want to make sure that this thing doesn't get out of hand. And I'll end with a positive on this. I saw it down in Red Wing, and because it was Easter, I think for many of us it was a very different Easter. I know in our family it's the time of celebration of dressing up, going to services, and then of course big meals and the Easter egg hunts and things. They weren't able to do that in Red Wing, but everybody in the churches down there all agreed to ring their bells and make noise at the same time. And so I think when you see a community come together, there's, again, not looking for ways to just short-term feel goods, but a sense that community is at the heart of a lot of what we're doing, that these are strong. It's going to take, again, it's not a governor's executive order that makes these things work. It's a people's willingness to work for their neighbors together. And I know I've asked a lot, but I can assure you, and I think you heard on the update today, there's reasons to be optimistic. There are plans to move us back to a more sustainable place. There is really good news on, I think, the capacity to be able to withstand and keep folks alive, whether it's our friends in New York or positive things coming out of Washington State, who's been at this longer. Minnesota's still in a really good place. As long as we continue to work together, we'll try to do our best to get more information. The questions being asked here are really good. Dave, if you're still listening, we'll try and follow up with you on that. I hear what you're saying, the questions about the reopening of business, and it's just difficult where there's 50 different states doing it differently, and there's no clear-cut pattern on this, and we're trying to craft this into a way that, yes, makes sense based on the science, but also acknowledges that the economic hurt is a toll that will continue for some time, and we need to strike that proper balance. So I want to thank you all, and I would leave final notes that everybody's being touched like this. I know the reporters on this call, your colleagues are being furloughed, and changes are being made, just like where everyone else is. But it's especially hard, I think, in media where we count on you to be able to ask these questions, to be able to keep pushing, challenging, and putting out information to folks to make sure where we're moving. So you have my thoughts are with those folks that are out there. We'll get you back on as soon as possible because the partnership with the media and the ability to get out the information is critical to beating this. So I want to thank you all, and we'll talk again tomorrow.
Find more local news stories at ccxmedia.org and follow us on social media.